What is fatty liver disease? The largest organ in your body is the liver. It aids in nutrient absorption, energy storage, and toxin removal in your body. When your liver becomes fatty, you have fatty liver disease. There are mostly two kinds. Alcoholic fatty liver disease, commonly known as alcoholic steatohepatitis, and non-alcoholic fatty liver disease, NAFLD. What is non-alcoholic fatty liver disease, NAFLD? A form of fatty liver disease called NAFLD is unrelated to high alcohol consumption. There are two categories: a simple fatty liver, which is characterized by the presence of fat in the liver, but little to no inflammation or liver cell injury. Usually, simple fatty liver does not progress to the point where it damages or complicates the liver. Non-alcoholic steatohepatitis, NASH, a condition that causes inflammation, liver cell destruction, and liver fat. Fibrosis or scarring of the liver can be brought on by inflammation and injury to liver cells. NASH may result in liver cancer or cirrhosis. What is alcoholic fatty liver disease? Heavy alcohol use is the cause of alcoholic fatty liver disease. The majority of the alcohol you consume is broken down by your liver, so it can be eliminated from your body. However, the breakdown process can produce dangerous byproducts. These chemicals can undermine your body's natural defenses, cause inflammation, and harm liver cells. Your liver suffers more liver damage the more alcohol you consume. The initial stage of alcohol-related liver damage is known as alcoholic fatty liver disease. The following phases are cirrhosis and alcoholic hepatitis. What are the symptoms of fatty liver disease? Alcoholic fatty liver disease and NAFLD are both typically quiet diseases with little to no symptoms. If you do experience symptoms, you might feel exhausted or uneasy in your upper right abdominal region. Who is at risk for fatty liver disease? The cause of non-alcoholic fatty liver disease, NAFLD, is unknown. Researchers do know that it is more common in people who have type 2 diabetes and prediabetes, have obesity, are middle-aged or older, although children can also get it, are Hispanic followed by non-Hispanic whites. It is less common in African Americans. Have high levels of fats in the blood, such as cholesterol and triglycerides. Have high blood pressure. Take certain drugs, such as corticosteroids and some cancer drugs. Have certain metabolic disorders, including metabolic syndrome. Have rapid weight loss. Have certain infections, such as hepatitis C. Have been exposed to some toxins. About 25% of persons worldwide have NAFLD. The prevalence of NAFLD is increasing in the United States along with rates of obesity, type 2 diabetes, and high cholesterol. The most prevalent chronic liver disease in the U.S. is NAFLD. Only heavy drinkers, especially those who have been doing so for a while, are susceptible to alcoholic fatty liver disease. Women who are heavy drinkers, obese people, and people with particular genetic abnormalities are at higher risk. What are the treatments for fatty liver disease? Losing weight is advised by doctors for non-alcoholic fatty liver. Weight loss can lessen fibrosis, inflammation, and liver fat. You should stop taking a certain medication if your doctor suspects it is the root of your NAFLD. Nevertheless, before stopping the medication, see your doctor. You might need to gradually stop taking the medication and switch to a different medication in its place. For the treatment of NAFLD, no medications have been licensed. More research is required to determine whether vitamin E or a specific diabetes medication can be helpful. The most crucial step in treating fatty liver disease brought on by alcohol is quitting drinking. You might wish to visit a therapist or take part in an alcohol rehabilitation program if you need assistance with that. Medications can also be helpful because they can either lessen cravings or make you feel ill if you consume alcohol. Cirrhosis can result from both alcoholic fatty liver disease and one kind of non-alcoholic fatty liver disease, non-alcoholic steatohepatitis. Cirrhosis-related health issues can be managed by doctors using medications, surgeries, and other treatments. You might need a liver transplant if the cirrhosis causes liver failure.